So I want to welcome everybody to this. This is the first Systemic JIA Parents' Day at Cincinnati. Maybe ever. I've never seen one before, but certainly here. My name is John Boutelle. My son, Vikram, was diagnosed with systemic disease when he was 1 year old. Today he's 5. He was also diagnosed with lung disease a couple of years later at the age of 3. We are from San Francisco originally, but as his condition got more and more serious, we looked at our options and decided that the best thing for us to do was to move here to Cincinnati, and we've made Cincinnati our home for the last couple of years. Our goal for this conference today is really simple. We want to strengthen the network of parents with each other to help fight this disease, because together we're strong. And I'm going to be talking a little bit about the things that we can actually do. And we have a lot more levers maybe than we sometimes think that we do in terms of the things that we can do about this disease. I think it's important that we have an exclusive focus on systemic JIA. I don't know about the rest of you, but when my kid was first diagnosed, I went to a bunch of JIA events and hunted around for that one systemic family to pump for information and try to understand what I had to look forward to. And I sat through a lot of content that was very interesting but wasn't necessarily oriented towards the problems that my kid had. And systemic JIA is a really serious disease that needs to be dealt with on its own terms. So I think there's a lot of clarity and efficiency and leverage in getting us all together and just focusing purely on systemic JIA for one day. We're used to thinking about doctors helping patients, right? And we're so grateful to all the doctors in this room and to all the rheumatologists that have helped our kids, get to the point where they are and to help them stay healthy. But I want to encourage everybody for the next couple of minutes to think about flipping that model on its head and think about the power of the patient, because especially now that we're all connected together with the internet, there's a lot more that we can do. And the Facebook group is a very powerful part of that. How many people here are members of the Systemic JIA Facebook group? Okay. Are there any parents here that are not members yet? Okay, you don't have to raise your hands if you're not, but you should definitely sign up because it's amazing. And what it lets us do is work together to get things done, and there's things that we can do that the doctors can't. I mean, one of the most important responsibilities that you have as a parent of a kid that has a rare disease is collaborating with your doctor, and I think that's where we live, day in, day out, helping our doctors help our kids, right? Taking pictures of rashes, measuring temperature on a daily basis, remembering, what happened 3 years ago when the dose of medicine X decreased and side effect Y happened, right? So I'm not going to belabor that. The thing that the internet allows us to do is help other parents much more efficiently, and especially if we get a little bit of FaceTime and we get to know each other better here, and then we go back, we can help each other even more when we're distributed again. Simple things, like I shot a video a couple of weeks ago of how to do a particular kind of preparation of a Kinneret syringe, right? And that was something that some other people didn't know how to do, and now they can just watch that video and copy it. More complex stuff, like my kid's having MAS and the doctor isn't taking it seriously. What should I do? Where should I go? My kid has lung disease. What should I do? Where should I go? We can help each other, and that's really powerful. But the thing that I think is probably most exciting and is also most daunting is the idea of moving, not just helping our own kids or helping a parent do the stuff that we do, but helping it to actually move the field forward, helping to find a cure for the disease or find better treatments for the disease. And that seems just impossibly daunting if you think about it from the complexity of the biology and the fact that we're not rheumatologists, right? How can we hope to add any value to this problem? Well, the good news is that there are already rheumatologists, and that's their job. We don't have to do that. We don't have to master all the biology, although it is almost scary how up-to-date many of the parents in this room are on the latest research and how facile people are with the terms about and the understanding of the systems of the innate immune system. But what we can do is that we're allowed to talk to each other and we're allowed to communicate, and we have the 30,000-foot view of the entire United States, right? Doctors are really constrained to the patients that they see, and every doctor only sees a very small number of patients because systemic is a rare disease, right? So each individual rheumatologist is not seeing that many patients. But together, we can do things like when there's a study, and I believe there's a study today that's collecting both participants and samples. Is that right, Rashmi? Yes, yesterday, okay. So when there is a study that is looking for systemic kids, we can make sure that everybody knows about that and sign up, and we can, I mean, think about this, we can fight this disease with our own children's blood. I mean, it's kind of gross, but also kind of primal and amazing. You know, our kids' medical records and DNA data, and just saying yes anytime anybody asks you to sign a form does a lot. When they're trialing new drugs, we can make sure that all the kids in the country who would be particularly or possibly, you know, qualify for that trial, find out about it, are able to go so that that trial fills up quickly, so that we find out quickly whether that medicine works or not, right? So there's a lot that we can do that doctors can't because they're constrained by HIPAA, and they're looking at this, looking through this keyhole of the you know, 5 or 10 patients that they see with our disease, whereas we're looking at a much broader, much shallower view. So together we can do great things. I want to talk just for a minute or two about our foundation. Rashmi and I created the Systemic JIA Foundation after Vikram was diagnosed with Systemic JIA. And our first focus was on funding registries. So we gave money both to the CARA registry, which is a sort of a broader JIA registry, but also to a project at Stanford called the SJIA ILD registry. It's kind of a mouthful, but the idea is to track patients that have lung disease and systemic and really dive deep into what's going on with that population. From there, we went on to organizing conferences on both coasts, bringing together not just clinicians and researchers, but also pharma companies, regulators like FDA and the European equivalent, and parents as well, though not as many, obviously, as are in this room today. And we've also started trying to fund a little bit of research. There's a project that we're funding that is looking for biomarkers for SJIA in a large sample size. So that's what we're doing, and I'm just hoping today we can strengthen our network and work together to help to find a cure. Our motivations are the same as your motivations. We got sick kids. We want them to be better. We want all the kids that have this disease to be in a better situation a year from now. With that, I'd like to introduce Dr. Brunner. She's the head of rheumatology at Cincinnati Children's, and she's going to be talking a little bit about the doctor's perspective on what we're going to be doing today. Thank you.
Well, welcome to Cincinnati, and welcome to Cincinnati Children's again. Let me try to master this microphone here. Well, I'm pleased to see you all here today. As the director of the division, I would like to tell you a little bit more about our place aligned. You may know that the Division of Rheumatology here at Cincinnati Children's is actually one of the oldest one in the country. It's over 50 years old, 50 years old. And our mission is to improve the lives of children with rheumatic diseases through education, clinical care, and research. And over the last couple of years, we have really focused on systemic JIA. That's evidenced by the fact that we ran clinical trials that led to the approval of tocilizumab and canakinumab, all medications you're familiar with. And we have an enhanced research focus with Dr. Grom and more recently Dr. Schulert to basically explain the complication of systemic JIA and also the origins of it. Lastly, we have a large educational effort to educate pediatric rheumatologists that are experienced in the care of children with systemic JIA. Because we are running a little bit late, I think I'm going to leave it by that, and I'll tell you more about the approach and about systemic JIA later on during the day. Thank you.